What is the difference between the flu and RSV?
Great question. RSV, which is respiratory syncytial virus, is again another type of common cold virus. Flu is predominantly a virus that causes more deaths than RSV. We said about 40 to 80,000 in the United States alone per year. RSV, somewhere 10 to 20,000 or so. RSV is a milder version of an influenza-like illness. So when people have RSV, sometimes it's indistinguishable from the other viruses I mentioned. RSV can present with nasal congestion, cough. RSV is a little bit more mucus producing. So some folks that have underlying lung disease, say chronic bronchitis, can really make that bronchitis a lot worse because it tends to involve a little bit more of the lower airways that are there. Influenza, for the most part, can kind of stay in the upper airways and go throughout the body. That's why you feel like you've been hit by a truck. RSV can potentially compromise the airways, particularly in people with underlying lung disease, because they cannot tolerate the secretions that are occurring within the airways. And so people feel that when they're suffocating because there's a ton of mucus that's there. That's why they seek medical attention. And then since we're on the topic of vaccines, it has made the news that there is a new RSV vaccine principally for individuals in which it's been studied, and it's being studied now more in the general population, that it's impacting them doing better with that infection than if they were not vaccinated. So that's sort of the new kid on the block when it comes to protecting oneself.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.